Hello and welcome everyone to Ask Your Doctor. This is an informative health session that is sponsored by My American Doctor. My American Doctor is a group of highly trained and experienced doctors that represent all specialties and provide second opinions throughout the country. We are not here to give individual health advice or treatment plans, but to just give a general idea of certain conditions. If you still have any questions or need further clarification, you can get in touch with us. I do encourage the live audience, if you're watching us, to go ahead and answer or ask us any questions. We will answer those live here. If not, you can go ahead and visit our website at myamericandoctor.com or go ahead and give us a call at 919-914-941-494 to book a second opinion consultation with one of our specialists. Today, we have the opportunity to speak with Dr. Mohammed Alhajji, a highly accomplished nephrologist and internal medicine physician with over 15 years of experience across the United States and the Middle East. He is a graduate of Dow Medical College, Karachi University, and has trained in internal medicine at MedStar Franklin Square Medical Center in Baltimore and completed a nephrology fellowship at the University of Minnesota. He is board certified in both internal medicine and nephrology, licensed in Arkansas and Missouri, and recently certified by the Saudi Commission for Health Specialties. With expertise in managing chronic and acute kidney conditions, dialysis care, and patient education, he brings a truly global perspective to kidney health. Today, he will be sharing his insights on the rising challenges care strategies in nephrology with a focus on South Asia and beyond. Thank you so much, Doctor, for being here today. How are you doing?
Thank you. Thank you for having me. I'm good. Morning.
Yeah, and yes, joining us from Arkansas, correct?
Yes, that's correct.
Awesome. Yes, awesome. Well, yeah, thanks for having us or being here with us. We appreciate it. We are super excited to get in today's conversation. So I kind of want to start with what are the most common reasons a patient would be referred to a nephrologist nowadays?
Yes, most common referrals comes to the nephrology office or those with a chronic kidney disease. They are detected by either rising creatinine acutely or chronically. Other referrals due to abnormal protein in urine, which is as a complication sometimes from diabetes or other immune disease. We
Mhm.
also get referrals for electrolyte imbalance like sodium, potassium, and we increasingly now we see cases for resistance hypertension as well.
Mhm. Yeah. So, can you kind of talk to us about the patterns of kidney disease and how have those changed over the past decade, especially in like South Asia?
Yes, and over the past 10 years, lifestyle related conditions such as diabetes and hypertension, they become the more leading cause of chronic kidney disease in South Asia. And in the past, there used to be infection, immune disease, glomerulonephritis, but due to this urbanization and processed diet, sedentary lifestyle, they drive this epidemiological shifts to the diabetes and hypertension.
Yeah, and we always see how just important lifestyle and just dietary changes are in preventing these types of diseases. Could you kind of elaborate on the role of those dietary patterns in maintaining kidney health?
Yes. Um, the the early detection is a key, and try to screening those high risk individuals of diabetes and hypertension. And the lifestyle modification is powerful tool in those patients. Maintaining healthy weight, exercising regularly, avoiding smoking, and keeping their blood pressure and blood glucose level under control.
Mhm.
And Another key to avoiding kidney related condition is avoiding unnecessary painkillers, medications such as NSAIDs. They carry risk for kidney disease if you take them chronically.
Mhm. And are those medicines like ibuprofen, like Tylenol, like those types of medications then?
Uh, the ibuprofen, naproxen, Advil, Motrin, these medication we call them non-steroidal anti-inflammatory drugs.
Hmm. Hmm.
Tylenol is not part of this, so it will be okay.
Okay, yeah. So kidney disease then can be prevented. Is that what you're saying?
Yes,
With these lifestyle changes, these good habits
yes.
that we have.
Avoiding
Okay.
nephrotoxic agents, yes.
Yeah. So I kind of want to move into kidney disease and cardiovascular risk. Is there a connection here between kidney disease and cardiovascular health that you could kind of walk us through here?
Yes, they kidney disease and cardiovascular disease. These two conditions we call them. They are very deeply intertwined. And chronic kidney disease can carry risk for heart disease by increasing blood pressure, increased calcification, and chronic inflammation. And on the other hand, the heart disease, especially heart failure, congestive heart failure, can decrease the blood flow to the kidney and worsen kidney outcomes.
Mhm. Mhm. And so how
Yes.
do you approach managing patients that maybe are hypertension resistant to hypertension with chronic kidney disease? How do you approach managing these kind of situations with these patients?
Um, Resistance hypertension is not common, but when it's happened, I usually make sure that they are adhering to their medication, make sure that they taking their medication on time as scheduled, and
Mhm.
optimizing diuretics. Even loop diuretics can be used on in advanced stages of kidney disease. It will help this resistance hypertension. In some patients, we have to use mineralocorticoid receptor antagonists, such as
Mhm.
spironolactone, which help in those conditions because it's related to high aldosterone release. Um,
Mhm.
um, then I will try to find other causes. If this is not improved, I try to find other causes such as renal artery stenosis or sleep apnea sometimes can cause resistance hypertension, and we need to have these two conditions under control as well.
Yeah, yeah. And so when we talk about this medication that you prescribe to your patients, and could you kind of talk about the treatment plans then that you would give to your patients who come in and maybe are diabetic or have diabetic kidney disease?
Yeah, the newer medication for diabetes is also a protective to the kidney. This medication is SGLT2 inhibitor. They lower the risk of and they lower the progression of kidney disease uh, by and also they lower the risk of cardiovascular as well, independent of glucose control. Same thing with a GLB-1 receptor agonist. This medicine can lower their optimizing their glucose and also helping with weight loss. So they provide a protective to the kidney and the cardiovascular as well.
And so are these the most common then medications that you would prescribe to your patients?
Yes, I try to make sure that all my kidney patients they are on first the RAS blockade is a must, and if there is no other contraindication and they are diabetic, they will have them on SGLT2 inhibitors and or GLB-1 agonist as well.
Mhm. And when you prescribe these kind of medications, then do you also prescribe that kind of lifestyle change and dietary change as well?
Yes.
Yeah. Well, I kind of want to move into kind of anemia management in chronic kidney disease. Could you talk about the latest developments in treating anemia in chronic kidney disease?
Yes. Traditionally, we treat anemia of a chronic kidney disease by erythropoiesis stimulating agents such as erythropoietin and ibogen. But nowadays we have a newer agent. It's called hypoxia-induced factor stabilizer. These drugs is stimulate the body natural response to low oxygen, and by doing that, you will enhance their endogenous production of erythropoietin instead of giving them with the injection. And also will help with the iron metabolism. This newer agent is promising for
Mhm.
treating patients of anemia and chronic kidney disease.
And is that come in like a pill form or is that kind of like an injection? How does that come to the
Yes,
patient?
this medicine is given orally as a pill form. Yeah.
Okay. Okay. And they just kind of take it home, do it themselves
Yes.
then? Yeah.
Yeah.
Yeah. So kind of thinking about acute kidney injury here, it has definitely been a growing concern. What are the key elements in recognizing it early and kind of managing it effectively, especially in hospitalized patients?
Yes. Vigilance is a key. Those hospitalized patients need frequent monitoring of their urine output
Mhm.
and daily creatinine. And so that will provide us an early detection of acute kidney injury. And
Mhm.
then we will have the prompt action uh, to, uh, to deal with it before it progress, like restoring their volume, stabilizing their blood pressure, treating any infection related to that, or stopping any nephrotoxic medication that causing AKI or acute kidney injury. Yes.
And can you elaborate a little bit more on kind of like early detection? How do we get on top of that?
Yes, as I said, the those hospitalized patient, if you notice any uh, small rise in their creatinine, or if their urine output start to go low, or they start to swell, then you try to um, consult the nephrology earlier and take these steps to prevent further progression of the AKI and try to
Mhm.
treat it before it gets worse.
Mhm. So, what preventative strategies do you recommend to avoid contrast-induced kidney injury, especially during maybe diagnostic imaging or CT scans?
Yes, hydration is a must. Hydration um, before, during, and after, either by using oral hydration before the treatment of contrast or using the IV hydration, normal saline we use um, to hydrate the patient during the procedure to prevent this contrast induced nephropathy. Then I also recommend that to use the lowest amount of contrast possible for this procedure. And also, we will recommend the either isoosmolar or low osmolar agents. Um, and for try to detect those high risk patients for contrast induced nephropathy, and make sure that they their medication is being managed, stopping their diuretics. And some of these high risk individuals, which I talk about, they are those with cardiovascular congestive heart failure, diabetes, or having chronic kidney disease, and they are hypotensive. They are at higher risk of developing contrast induced nephropathy. and try to find this patient and try to follow the recommendation as with the hydration, and using a small amount of contrast is sometimes will help with this prevention.
Yeah. So I kind of want to move into dialysis choices. First of all, could you kind of just break down like what is dialysis for just like regular people kind of watching this? Could you kind of explain that to us?
Yes, dialysis is a procedure where we try to clean up the blood outside the body, just like
Hmm.
an extra uh, kidney outside your body. It will take the blood out of your body and will run it through to the filter. The machine will have filter, and it will clean up the blood, take the bad toxins out of the blood, and leave the good blood back to return it back to you. And during this process, also we will be able to remove the extra fluid out of the blood and help with the fluid management, and that's for the hemodialysis. The peritoneal dialysis is this kind of similar procedure, but we use the gut lining in your abdomen as a kidney. It will usually the we will insert a catheter into your belly and will infuse certain percentage of dextrose fluid inside your belly, and that will make shifts of toxins and fluid in between the gut membrane um, to the from the blood to the internal and then we'll take it out, drain it, and that will work as a
Hmm.
kidney as well. It's work
Hmm.
similar like the dialysis. That's the peritoneal dialysis, and the other dialysis, the blood dialysis, which we
Hmm.
use either AV fistula or a catheter in the chest.
Hmm. And how do you like decide which one is right for each patient?
Uh, well, it's usually the choice of depends on patient medical problem and their
Hmm.
lifestyle and their support team. But hemodialysis, it's offer a rapid clearance, and but it carry cardiovascular risk because it stress the heart. Because if you do it rapidly,
Hmm.
um, it can have issues with it. Sometimes hypotension with the hemodialysis. Uh,
Hmm.
the peritoneal dialysis is more for independent patient. They can do it at home at their own convenience. It's also very gentle in a fluid removal because it's for a long period of time, and they do it every day. Uh, um, so it actually depends on the patient choice, and also if the patient is really can do the task themselves, or they are totally independent.
Yeah, yeah. And so when does a patient then get to this stage? Is this like kidney failure, then we're doing dialysis, or when does this kind of come in?
Well, so we will try to avoid this, kidney failure by, protecting medication that we discussed about earlier. But unfortunately, some of the patients, especially with diabetes, they continue to progress into kidney failure. And a kidney failure, when their GFR it goes less than 15, we label them as a kidney failure, um, and this is a stage 5 kidney disease. And at this stage, usually some patients they'll start to have a problem, and their symptoms start to appear. They'll have fatigue, tired, hiccuping. They'll have metallic taste in their mouth. Their hands will be shaky. They will be cramping. They will be itching all over, dry skin due to the high phosphorus level in their blood.
Mhm.
And when they are, it's either they come with symptoms, or when their filtration rate goes below 15, we will offer them to go into dialysis.
Yeah, yeah. And could you give us maybe like practical advice that you offer your kind of newly diagnosed dialysis patients to help them adapt physically and emotionally to treatment? Because this seems like it is definitely kind of taxing on the body and the mind.
Yes. I usually encourage my patient to focus on adaptation rather than limitation. Um,
Mhm.
Staying active, following a friendly renal diet, adhering to their medications and treatment plan, and also seeking psychological and peer support.
Mhm.
Um, this emotional adjustment to takes time, and
Yeah,
patients should not hesitate to lean to their families and support team and care teams
yeah,
to help.
yeah, yeah. So, do you see challenges then, or complications then when that dialysis patients kind of experience, and how can us healthcare providers kind of address those?
Yes. The most common complication that's happened during dialysis is intradialytic hypotension, the low blood pressure during dialysis. And that could lead to cramps, ultrafiltration issues. And we try to solve this by either adjusting the fluid removal rate and goal, um, using cooler dialysate to help raising their blood pressure during the treatment, or maybe reevaluating their dry weight and make sure they are in the weight that they are supposed to prevent this hypotension. Uh,
Mhm.
Other complication that could happen during dialysis is either clotting or bleeding problem, and we treat this by tailoring their heparin use during dialysis
Mhm.
to
Yeah,
prevent the clotting, or and also make sure that they don't get higher dose that cause bleeding.
yeah. And that hemodialysis, how often do patients do that then?
Uh, for the hemodialysis, there's two types. There's hemodialysis you can do on center, where you can go 3 times a week. We usually prescribe for 3 times a week, either Monday, Wednesday, Friday, or Tuesday, Thursday, and Saturday. And there is a home hemodialysis. They can have a small machine, they take it at home, but we'll train the patient how to do their dialysis themselves at home at their
Mhm.
convenience. And they can do this 4 times or 5 times a week.
Yeah, yeah. That's awesome to have that available to patients who maybe don't always want to come into the doctor's office, or they can just kind of be at the comfort of their own home. I think that's awesome.
Yes.
Yeah, yeah.
Peritoneal dialysis, they also do it at home, but this, again, it's through a peritoneal catheter in their belly, and they do that every night, mostly at night time. They do it at home
Okay. And that's, you said every day?
every night. Yes,
Nice. Okay.
either
Yeah,
either day or night. It depends on their treatment plan.
yeah, yeah. So when we talk about these patients then who live with this chronic kidney disease, beyond medical management, what psychological and lifestyle challenges do these individuals face?
They m- the, kidney failure is a disease with even on dialysis, they will be exhausted, fatigue.
Okay.
Um, there is a lot of dietary restrictions. These are
Mhm.
challenges for the patient to tell them not to eat certain type of foods that they love because it carry high potassium or high phosphorus. It's difficult for them.
Mhm.
Also, it carries a financial strain,
Yeah.
transportation, um, and then as we discussed, there's will be those patients will be having an anxiety about their progression of their disease,
Yeah.
um, and depression. Depression is also happened a lot in dialysis patient, and it's often underdiagnosed as well.
Yeah. Yeah. And so how do you recommend then how families and communities can play a meaningful role in kind of supporting these patients?
Family can play a good the family are a good help for the patient because they can
Yeah.
help them with their diet, how to choose their renally friendly diet, and also offer them a transportation, emotional support,
Mhm.
um, that will help the patient to be adhered to their treatment and medication, um, and also ask them to have some community educational program that raises awareness and builds a network of support to the families and patients as well with this
Yeah.
chronic kidney disease.
Yeah. And just curious question then here, what kind of are the dietary changes that you recommend to patients? Like what are the foods that you recommend like staying away from?
You talking about the dialysis patient or
Yes. Yeah.
so dialysis patients often have issues with their potassium and phosphorus. So
Mhm.
that we recommend them to have a diet that have less in potassium and less on phosphorus. Um,
Mhm.
and we usually, our dietitian in dialysis, they brought for them a list of food that they are allowed uh, to take and food that are not allowed. Even for soda, the patient who drinks soda, we have options for them. You know, light color soda will have low phosphorus. Dark color soda have high phosphorus. So we give options for the patient to choose.
Yeah, yeah. So the patient then works kind of alongside a dietitian then in these cases.
Yeah,
That's awesome
and
to have
then
that.
yeah, we work with them. And before they go to dialysis, we told patient to um, do protein in moderation or decrease their protein intake because it's less stress to the kidney. But after dialysis, we ask them to eat more protein diet because the dialysis itself it will deprive the body from protein, so they have to replenish their protein intake and ask them to eat more and more protein.
Yeah. Yeah. That's awesome that patient then kind of has that community around to help in all aspects of that kind of patient care there. That's awesome. In the beginning here, we talked about the kind of South Asian countries and the
Yeah.
unique kidney health challenges that are emerging in these places compared to even the United States and the Middle East. Could you kind of talk about those unique kidney health challenges that are emerging in South Asia?
Yes. Well, it's many patients they present late to in a later stage of kidney disease where options are limited. Um, then access to affordable dialysis is also an issue. Transportation and um, transplant is a major barrier in some of these countries. um, Infection risk, environmental toxins that are high,
Mhm.
um, unregulated medication in South Asia is a lot, and it's caused a lot of challenges to in that region for
Yeah,
nephrology.
yeah. Yeah, and what like how do cultural practices, maybe dietary habits or these access or non-access to healthcare, how does this influence kidney disease prevalence and outcomes in these certain regions?
Yes, it's high salt consumption, um, and frequent use of herbal remedies, um, uh, limited awareness of about kidney disease and can contribute to this higher prevalence on that
Mhm.
region.
Yeah.
But on the other hand, these regions, especially South Asia, they have a strong family connection and strong family structures that provide critical support once the patient is being diagnosed, and that will improve their adherence to the care and outcome.
Yeah, yeah. So it's yeah, again, important to have that kind of community around you. But really important to make sure your lifestyle, your dietary
Yeah.
factors are just kind of in line and in check. And definitely having access to this education is really important for just everyday people to kind of understand about kidney disease, kidney failure, everything like that. So we appreciate you being on here with us today, Doctor. Do you have any other words of encouragement or anything to patients who are dealing with these diseases or are on dialysis?
Yes, I just encourage patients to present early and ask their doctors if they have any noticing any changes to their urine output or they having any symptoms, um, and encourage also other specialities to seek our help of that. So, if they noticing any changes in the patient creatinine.
Yeah, yeah. Well, thank you so much, Doctor, for sharing with us today. We just appreciate your passion towards this and towards your patients. So we appreciate all of the information that you shared with us today. I'm sure anyone watching is going to learn something. So we thank you so much for being here today. Have a wonderful rest of your weekend.
Thank you for having me.
Thank you. Bye-bye.